My name is Doctor Stefano Sinicropi. I'm a board-certified orthopedic surgeon. I've been in practice 18 years, having done 9,000 surgeries. And over the last couple years, I've become a huge proponent of the use of photobiomodulation to treat patients, including red light beds, okay, which is whole body photobiomodulation, and laser therapy, and we are currently using class 4 laser therapy for a whole host of conditions. Now, in order to discuss photobiomodulation, we really need to talk about what does photobiomodulation mean. Now, let's break it down. Photo is light, bio, tissues, modulation to change something. So the exciting thing as a physician is we're able to change human tissues with the use of light. Now, there are over 6,000 articles referencing photobiomodulation and treatment of a whole host of different conditions. And it is something that is going to be growing rapidly in the community, and it is the future of the way we're going to be treating a whole host of different diseases, whether the primary treatment or a secondary treatment to help in the improvement of symptoms and or function. Now, I've recently had Dr. Scott Sigman, the inventor of Ortho Laser franchise, which is rapidly spreading across the United States, as well as Dr. Paolo Cassano, the head of the photobiomodulation lab at Harvard. And the reason I brought them on the program was to validate and show what an incredible opportunity we have in front of us to use light therapy to improve a whole host of different conditions, everywhere from musculoskeletal pain all the way up to complex brain conditions, including Alzheimer's disease, Parkinson's, cognitive decline, and many, many others. Now, how does the photobiomodulation actually work? Let's focus on the most common frequency that we use, which would be in the near infrared range. Why is this important? It's important because light in the range of the 800s or near infrared light can penetrate tissues deeply, bypassing the skin level, the tissues, the different areas of fat, muscle, all the way down to the bone. Now, what happens when near infrared light hits a cell? It is absorbed by the cell, and then it gets into the mitochondria of the cell. The mitochondria are the powerhouses of the cell. They're the engines. They're the power electric plants of the cell, and they produce gasoline, which is called ATP or adenosine triphosphate. Now, guess what happens? Similar to the process of photosynthesis in plants, in animal tissues, photobiomodulation or near infrared light penetrates the mitochondrial wall, creating a chain reaction that then stimulates production of ATP, increasing the amount of energy available, increasing functioning of cells, but also sends a message to the brain of the cell called the nucleus, telling it to create different proteins and changes the way the cell itself behaves, including preventing the cell from being sick or preventing the cell from dying altogether. And therefore, with the use of light therapies, we can actually change the way that cells move, and we can flood the entire body and affect millions and millions of cells. We can also hyperstimulate specific areas by using more powerful devices such as class 4 laser therapy, which is more directed at a specific area. One good example of class 4 laser therapy would be to treat an ankle injury or a hamstring injury. But we are also using laser therapies to penetrate the skull and affect brain health and brain functioning with improvement in cognition and tasks and other things, which obviously are going to improve things like concussion, where there's a randomized controlled study that shows dramatic improvement in concussion. There are ongoing studies in Parkinson's disease and other neurologic diseases. So in summary, photobiomodulation is absolutely the medicine of the future. I am excited to be part of the group that is trying to lead the charge and trying to get together with as many experts who are leading the way in photobiomodulation. I hope you found this very helpful, and I will tell you, there is nothing pseudoscience about red light therapy, laser therapy. It is based on hardcore scientific principles that have been shown time and time again at world-class institutions. I hope you found this helpful, and let us know in the questions and comments what your thoughts are.